Welcome back. Well, you might be feeling a little ripe in the mouth at this point. We've been in lockdown for a while now, and especially with your kids, if you're worried about trying to get them to take care of their teeth, you may have an uphill slog, especially as we open things up. People are all trying to get back into the dentist all at once. You may have a wait. And so to try to keep things under control at home and to give you options in case you do encounter a teeth or dental emergency with your kids, I'm joined tonight by Dr. Kevin Donnelly, who is the head of the American Academy of Pediatric Dentistry, with some great ideas and tips and insights about what's going on with dentistry in light of the COVID-19 crisis. So Dr. Donnelly, thank you for being here, and let's get right to it. How has this COVID crisis impacted pediatric dentistry?
Well, there's been a lot of differences, mostly in pediatric dentistry and general dentistry, by us only being allowed to do emergency care. And that was really recommended through the CDC and most governors of the state. And the reasoning was to have people not go into emergency rooms for dental emergencies, because we didn't want to overburden the emergency rooms when they're dealing with firsthand COVID virus victims, and to actually preserve PPE, personal protective equipment, because we really needed that for the frontline people, ER physicians, ER nurses that are really treating people with the virus. And in the meantime, we've been able to get a handle on the level of the virus, how much PPE we have available, and now we're able to come back and start to open practices again for non-emergency care.
You mentioned a dental emergency a minute ago. What type of situation constitutes a dental emergency?
Well, we really put them into three categories. One's trauma. I have three boys myself, and they're out there banging themselves around. And so if you have a tooth fracture, you need to see your pediatric dentist right away. Facial cellulitis, which are caused by infections from very, very badly decayed teeth. We need to see those right away because that can cause overall health problems, and we need to deal with it. And the other one is pain, and tooth pain can really be excruciating. And you need to call your pediatric dentist right away to get in and take care of that pain so your child doesn't suffer.
All right, so what should a parent do if their kid has a dental emergency? Do they call 911? You call the dentist? What?
Well, usually you can go ahead and call your pediatric dentist, and most likely they'll either have call forwarding or someone at the office to answer. If not, go on their website, and I'm quite sure they'll have information on where you can go or when they can be available to see your child. And also, without going to emergency rooms, there's also dental clinics available, and your pediatric dentist will let you know where that can be, where emergency care can be sought if they're not provided.
Now, what tips are good for oral hygiene, especially for your kids?
Well, I think the first thing we already discussed is brush their teeth twice a day with the fluoridated toothpaste. But the other thing is what I call grazing. And boy, I'm guilty of it myself sometimes, wandering over to that refrigerator and picking things up at random and eating them. Well, parents say, well, it's hard to control what the kids take out of that refrigerator at different times and eat. Well, what I usually say is what's available in the refrigerator is what you buy. And so I recommend, you don't buy high sucrose, high sugar drinks and things like that. And that way kids don't have the ability to sit around and drink those all day. The go-to is water, as you might guess, and milk for kids.
Dr. Donnelly, as people end up getting back into the swing of things and they start getting appointments set to visit their dentist, what types of precautions are our dentists taking to keep everyone protected from the coronavirus?
Absolutely. And so, like I said, there'll be pre-screenings to make sure we have as few people that are susceptible out there, in your dental office. We will check temperatures and things like that. But as you go into that clinic, you'll see all of the staff and the dentist wearing masks to protect from passing anything on to patients and things like that. Those are going to be differences in coats they wear and they dispose of after every single patient. And these are all precautions that people will see when they go to the dentist, particularly not a busy waiting room, and things like that, so that they can abide by social distancing and really have less of a chance to have any type of disease transmission.
And where can folks go for more information?
Well, I know it's hard to cover a lot of ground over these interviews, so parents can go to mychildrensteeth.org and get just an abundance of information about children's dental health, including what's necessary. We'll move to urgent care and then comprehensive care before school starts again.
All right, Dr. Kevin Donnelly, head of the American Academy of Pediatric Dentistry, thank you so much.
Thank you.
And folks, we'll be back after this.